Hi guys, welcome to this YouTube channel. My name is Dr. Wambugu, an ophthalmologist, aesthetic doctor with over 20 years experience as a medical doctor. In this episode today, we're going to discuss all things hair with special focus to Afro-textured hair. Please remember to like, share and subscribe. So I'll discuss the causes of hair loss. There are several causes of hair loss. I'm going to start with the first one, genetic. You can have a genetic predisposition to hair loss, and in men, it presents with loss of the hairline and loss of hair at the crown. Hairline is here in front, crown is here on top. So typically, it's very common, and the male pattern baldness presents by loss of hair on the hairline and on the crown, and it can either be mild or extensive. In women, genetic predisposition to hair loss presents as diffuse thinning. So you'll have generalized thinning of the hair with an intact hairline. So the baldness will not be exactly like that of men. It will be you'll present with less hair, like your hair will look like it's thinning or like it's not growing at the front, and you'll not get the typical baldness like for men. Men will totally lose hair, and even their scalp will be left shiny. But for women, they don't lose their hair like that. The hair doesn't totally disappear from the scalp. It's just like they're left with hair, but very scanty. The second one is autoimmune. By autoimmune conditions, this means that the individual is very sensitive to the immune system. So instead of the immune system fighting probably foreign bodies and bacteria and other diseases, it starts attacking itself. And so it will attack the hair follicles, leading to death of hair follicles and hair loss. So that is autoimmune. There are many autoimmune diseases that affect the hair and that affect the scalp. Some of them are just like localized to the scalp. Others are systemic, but most of them will just be at the scalp. So the person will have no other symptoms except hair loss. This needs to be investigated much further so as to come up with the right mode of treatment. Then the other cause of hair loss is stress related. And by stress, when we talk about stress in medicine or in health, stress is something that causes imbalance in the body. It doesn't just mean like social stress. Stress can be anything that makes the body strain. So when you talk about stress can mean like going through a severe illness, maybe being admitted in ICU. It can also mean severe weight loss, like if you lose a lot of weight, the body undergoes some strain. It's not used to that. It can mean childbirth or pregnancy, that is stress. It's even like emotional stress or being diagnosed with a new illness. Anything that throws the body off balance can be described as stress, and even a change of diet. And sometimes even change of location, like moving from one country and going to another country. The body, that is stress. Anything that strains the body can lead to hair loss. So you'll find that most people who have lost a lot of weight also lose a lot of hair. It's stress related, and it's treated and there are ways of treating it. Then now there's mechanical, number 4. Mechanical means anything that uses force to get the hair off the scalp. For example, traction, like when you pull off your hair or someone pulls off your hair, or when you style your hair in tight braids and tight cornrows, that will break off your hair. Chemical processes can destroy the hair, leading to hair loss. Heat, when you use too much heat on the hair, it breaks off. So those are mechanical causes of hair loss. Then we talk of nutritional causes of hair loss. Children who are severely malnourished, if we've ever been seeing children who are severely malnourished, they'll have hair changes. And it's one of the ways that we use to diagnose diseases like kwashiorkor, marasmus, and the rest. So you'll see the color changes. The hair may become curly, thin, and scanty. So nutrition is very important when it comes to healthy hair. So certain deficiencies can cause hair loss. Certain deficiencies like, let's say, deficiency in zinc, vitamin D3, iron deficiency, and other vitamins can cause hair loss. So it's a very important component when treating hair loss. Then drug-induced, the most obvious being chemotherapy. Patients who undergo chemotherapy lose their hair. And also there are many other drugs that cause people to lose hair, even in small amounts. Scalp conditions, like which one, like dandruff, autoimmune conditions that we had discussed before. All these conditions affecting the skin and the scalp, because the scalp is part of the skin, will cause hair loss. Aging, normal process of aging. You look at people who are in their 90s and 100s, they would have the same head of hair, the head full of head of hair like a younger person in their 20s or 30s have. Medical conditions can lead to loss of hair. Like if you look at the hypothyroidism, low thyroid levels will lead to loss of hair. And when people come in with hair loss, we have to inquire like whether they have any underlying conditions, and not only inquire but also test before we embark on treatment of hair loss. That is why when you're trying to treat a patient, or when you discover that you have hair loss, you need to go to a medical specialist so that they can find out what could be causing your hair loss. Because if you decide that you have hair loss and decide to go buy biotin, there's no way you will know that you're lacking in that one biotin. You need to go and be tested and find out whether you have hypothyroidism, or you have autoimmunity, or you're lacking in vitamin D3 or any other condition. That's the video for today. We've discussed care for afro hair. We've also discussed causes of hair loss and treatment of hair loss. Please remember to like, share, and subscribe.